So when I was a young resident many years ago, neurology was just beginning to advance as a field. When you had a stroke 25 years ago, the truth is there's not a tremendous amount we could have done back then, but that's changed dramatically. And the same thing is true with respect to movement disorders and other types of neurological diseases. And so you stand tall because you stand on the shoulders of giants, and the people that came before the current members of the Riverside Medical Group, they really helped build the system in a way that made it the world-class organization it is right now.
Another very good example where the physicians absolutely led the way was the NeuroCase conference. Dr. Tom Regan was determined that having physicians in the room to share and interact, today it absolutely is one of the strongest clinical meetings that is held within the health system.
So we have that conference about 3 to 4 times in a month. And we have generally 4 different disciplines that we review, and those include neurology, which those weeks are really interesting because we get to watch patient videos of, for example, different tremors.
We have started doing what's called functional neurosurgery for movement disorders. So 2 of my partners, Dr. Salvant and Dr. Lamb, are treating Parkinson's disease and essential tremor with deep brain stimulator implantation, as well as with focused ultrasound, which is a technology that we've seen robust signs that that's a desired technology to have, and people with, particularly with essential tremor with Parkinson's, really benefit from that.
And then we have neurovascular, which are really cerebral type of days, no pun intended, because we review all the stroke cases.
Where the more innovative stuff that has come in from a stroke care standpoint comes into play is neurointervention. And that has grown over the last couple of decades into a robust ability to take care of things that previously were not able to be taken care of.
And then we have neuroradiology. They can do tumors, they can do just unusual findings. And then there's also neurosurgery, which presents with pathology. And usually the neurosurgeon will discuss cases that have pathology that are tumors, or they'll discuss cases that are tumors, but they've used gamma knife to treat those patients.
And then in the operating room, we've expanded to this technology called stealth imaging, which we use both on the brain as well as with spinal surgery, so that we've expanded the kind of spine surgeries that we can do, from simple little one-level laminectomies and discectomies to complicated spinal reconstructions. And now we've got this robotic arm in the operating room that helps us with spine surgeries called the Mazer X. So we've continued to bring more and more technology and providers that know how to execute and use that technology for patient care as relates to both neurology and neurosurgery and neurostroke care and neurointervention.
So neurohospitalist is relatively new, but what we do as neurohospitalists is we are consulted on patients who have neurologic diseases in the hospital. We make sure that the patient gets stabilized while they're in the hospital, and then as they are being discharged, we make sure that they're set up with our outpatient colleagues for follow-up care as needed. We've seen a dramatic increase in the amount of stroke calls. We've seen about a 3-fold increase over the last 3 to 4 years. We have our challenges in trying to figure out how to manage that volume. And I think our team has answered those challenges, and you can see that with our certifications from the DNV for comprehensive stroke. But those are just numbers. If you look at our patients, they are often walking out of the hospital, and I think that's been a really great thing to be a part of.
So much of what we have today started in the past with these amazing private practice physicians, the risk takers, who were willing to come here. Some of them were coming home again. Some of them were not from here at all, Dr. Rinaldi. But they are who attracted the talent that you have today. That's who attracts the talent that will be leading us and feeding neurosciences into the future.